Call the March 26th meeting of the Spokane Regional Health District Board of Health meeting to order. We have a quorum present. If we could start roll call with Mr. Baldwin.
Keith Baldwin, appointed member.
Mike Fagan, City of Spokane.
Susan Norwood, appointed member.
John Snyder, City of Spokane.
Ed
Joel
Pace.
Sorry.
Oh, go ahead. Joel McCullough, Spokane Regional Health District. Ed Pace, Spokane Valley City Council.
Kevin Freeman, Mayor, City of Millwood, Small Cities Representative.
Michelle Fossum, Legal Counsel.
Ann Pittsnoggle, Recording Secretary.
And do we have any scheduled citizen input today? Seeing as it's a quiet day, we have no citizen input at this time, so a chair report. Mr. Hafner is out today, so as the acting chair, I will run through a few items. In your packet today, we have the new emergency contact cards. So note your emergency contacts. Find your phone buddy. Go from there. So that has been updated. The second item is a reminder of the Health Officer Evaluation Survey. The link for the officer evaluation was sent to you on March 20th. The deadline for completing that is April 3rd. If you have any questions, call Ann with that, if there's any issues on that. There is also the Board of Health Committees update. So in your packet, you have a 2015 BOH committees. We have the Budget and Finance Committee, Education and Communication, Governance, Policy, TFE permit, which is ad hoc, and the Executive Committee. Right now, there's still room available on Budget Finance, Education Communications, and the TFE. As everyone's aware, they're capped at 5. If you have any interest in serving, or if you feel that you're on the wrong committee for some reason, please let Ann know, and she will make those adjustments. We were to have a update on the temporary food enterprise from Shelley, but Shelley is still upstairs. So, can we table her update at this time and move on through the agenda? Yes. Okay. Do we have any other chair reports from any of the other governance committees? John, do you have anything from policy? Please.
We didn't meet, but we decided to change our membership a little bit because we were going to end up being two-thirds Spokane and one-third. We were going to end up being two-thirds Spokane and one-third Spokane Valley, and so we ended up adding a couple of members to the committee so that it was a little bit more. There's a little bit more input, and I think that's a good addition to the committee. So I want to. Welcome, in addition to Councilmembers Fagan and Councilmember Pace, we have, where's the list? We have Mayor Freeman and Dr. Lutz. So thank you for first agreeing to serve in the policy committee.
Thank you. And at this time, I have nothing to report as the acting chair from the executive committee. So seeing that is, we'll wait for Shelley to arrive and move on to the health officer report. Dr. Joel?
Today I will be covering updating you on the flu. I was asked to talk a little bit about the Healthy Youth Survey results and I'll give you some highlights of that. Update you on where we are with building remodeling. I was going to introduce you to a report that the State Department of Health produces called the Communicable Disease EPI update, so I'll talk a little bit about that. And finally, I will let you know that the date of the Washington State auditors will be on site. And I was going to talk about the county health rankings, but given that report was released recently, I didn't have enough time to sufficiently prepare you to compare the results this year to results from previous years, so I will save that for next month. So in terms of updating you on where we are with the influenza this season, so far there have been 16 confirmed deaths here in Spokane County, and that compares to 126 that have been reported in the state. And so far we have 367 hospitalizations of Spokane County residents with the flu this season. And as you can see, the vast majority of those have been influenza A, 346 influenza A and 21 influenza B. We are seeing a significant decrease in the flu this season, and the main change that we're seeing at this point is that there's a greater proportion of influenza B than influenza A now, over 50% B, but the numbers are fairly small at this point. So this is an epi curve of what we've seen for influenza this year. The purple line represents this year, and as you can see, compared to the last few seasons, we've had a greater proportion of hospitalizations this season, and that the peak of the season was in January with a rapid decrease shortly after that. So again, we're seeing decreased numbers this time of year with the flu, and which is typical. This slide shows the number of deaths in Washington State, not just Spokane, over the last several flu seasons. And as you can see, so far this year, we have 126. And if you look at the last column, you'll see that the flu rate is also increased for this flu season, meaning that greater numbers of people have died of flu this season compared to previous years. So, back up. So next I'll be covering the results of the Healthy Youth Survey. And we did produce a press release on March 13th, which showed some of the highlights here in Spokane County. Again, the Healthy Youth Survey is a statewide survey, and it's done every 2 years. And the students' grades are the 6th grade, 8th grade, 10th grade, and 12th grades. And about 1,000 public schools in Washington State participate. And here in Spokane County, about 10,000 youth took the survey last October. And the survey asks a variety of questions concerning health and health behaviors. And some of the highlights of the most recent results show that in terms of e-cigarette use, about 26% of sophomores said that they used e-cigarettes, and that's about twice the state rate for e-cigarettes in sophomores. In terms of marijuana use, 19% of high school sophomores stated that they used marijuana, which is also increased. In terms of electronic cigarette use, as well as marijuana among Spokane sophomores, are nearly double that of regular cigarette use. Cigarette use among the Spokane teens is also up. And the area of improvement, if you can say that, is in the area of alcohol use. And over the past month, the alcohol use among 10th graders have continued to trend down. So I think the main points of the survey at this point is that in terms of electronic cigarette use and vaping marijuana products, the youth do not consider them as risky. So there is more prevention work that we need to do to address these issues. In terms of the building remodeling, I think the major impetus for the remodeling here at the Health District relates to the growth of the opioid treatment program, and we're also trying to consolidate the vital records and the financial services areas. So the former laboratory space that's located on the second floor will be reused for our current WIC clinic, which is currently on the first floor. So the current WIC area will be expanded to accommodate the additional space that the opioid treatment program will require given the increased number of clients. And the next phase of the remodeling will be the financial services area, which is on the first floor. And so that remodeling work will take about 8 to 10 weeks. And so I think with all the additional work with the WIC area, financial services area, I think all that will be completed in the next 16 weeks or so. And if board members would like to a tour of that, I'm sure Tony will be able to accommodate you. The next topic is I'd like to talk about the communicable disease epi updates. For your information, the State Department of Health, every week they produce communicable disease updates for local health departments throughout the state. And these reports are of communicable disease topics of state interest, national interest, and of international interest. And given that we've been having these conversations over the last several years about the different communicable diseases, I thought I would regularly put these communicable disease updates in your packet. And it looks like this if you want to take a look at it. And usually there is, so if, for example, the usefulness of this would be, so if there's a whooping cough epidemic in Clallam County or some other disease outbreaks in other counties, I generally don't speak about that. But if there's interest by the board in other communicable disease issues that may be going on here in the state or nationally or international, there's generally a summary of that. So I'll generally make a point of including that as part of your packet moving forward. And finally, the state auditors will be on site here starting April 1st. And it's anticipated they'll be here for 3 to 6 weeks, depending on how many staff they send. So the good news for us is that they'll only be auditing 25% of our federal dollars because we're considered low risk. And so that's a good thing. In terms of the opening conference, we will let the board know when that is scheduled, because that's generally not scheduled until they come on site. And we will try to schedule that at a time that's convenient for the board to attend. So that's all I have for my report, and if there are any questions.
No questions for Dr. Joel? Thank you very much.
Thank you.
Please note for the record that members Waldorf and O'Quinn have arrived, and with Ms. O'Quinn being here, we would ask that if she could, to provide her committee update for the TFEs.
Great. We had one meeting a couple weeks ago, don't remember the date, and just really laid the foundation for why we were having the meeting, and then had some great discussion around it, sent the staff off to do some research and homework. We have our next meeting tomorrow, 10 to 11:30. Anyone is welcome to join us if they are available. So hopefully we'll complete our work within the next 3 or 4 meetings at the most. It's a good group. And thank you to Tony and the rest of you for pulling the advisory board folks in, because I think that they provide a great perspective. That's all I have.
Thank you. Legislative report from Linda.
Good afternoon. If you recall at last month's meeting, we talked about doing a resolution in conjunction with your legislative agenda. And we took what was talked about here to the governance committee, who met last week, and had a really good discussion, and basically ended up thinking about the fact that sometimes in January we don't have a quorum, which actually happened this year. Also the fact that in January we often have new board members coming on board. we might as well go ahead and sort of not do our typical two-touch process when it comes to things like this, and we will work at having a resolution at the December meeting when we're actually crafting the agenda and just kind of handle them both at the same time, if that works for everybody. Any questions about that? Okay, as far as legislative agenda items, I had an update for you in the packet. Just a couple updates on things since last week. Distracted driving bill 5656, and then the sick and safe leave bill. Oh, that's a different one, sorry. And the e-cigarette bill, 1645. Both of those are due to be exec'd out of committee on March 30th, next week. And then the sick and safe leave bill, that's actually set for a hearing finally on March 30th in the Senate. And the next couple of cutoffs, April 1st is the next one for policy bills to get out of the committees in the opposite house. And then April 7th, any of those with budget implications need to move forward. And latest I'm hearing is legislators are hoping to have just a normal session this year and not go into extension. And then budgets should be due out soon. So we'll be looking at public health implications in the budget. Any questions?
So do you know, I'm a little surprised to hear that the distracted driving bill may be exec'd out. I heard that there was some significant bipartisan opposition to it in the House. Do you know anything about what happened at the hearing yesterday?
No, I wasn't able to listen in on the hearing. But I know there has been a lot of debate over the bill. Some of it has been partisan, some of it has been across the board. There has been a lot of work to amend the bill. It started out, a big committee came together to draft the bill. There's been all of those involved in amending the bill to try and address some of the issues. And I haven't been able to check today whether or not there's further amendment expected, but I haven't seen anything.
Okay, thanks.
Anything else?
Any other questions for Linda?
Okay, thank you.
Thank you. Next on the agenda is the approval of our consent agenda for meeting minutes from February 26th and the vouchers for the month of February. Do I have a motion on the consent agenda?
Move to approve. Second.
Moved and seconded. All in favor?
Aye.
Aye. Consent agenda is passed. Thank you.
Good afternoon. So I have been asked to give a short presentation, and we are going to, oops, I'm sorry. It's got to go. There we go. We're going to organize them around the public health core functions. So the first one that we're going to talk about today is around assessment, and then you'll see two other presentations at some point during the year around the other two. So the public health standards, there's 12 domains, and the first domain is assessment or assess. And so what I'm going to do is really cover that domain and give you some examples of how we do that work and then why it's important. Also, as you know, assessment or data, use of data is very important to your own work. On the back of your agenda is the governance areas, and on the agenda it talks about the organizational excellence governance responsibility, but I would say it's a cross-cutting issue that goes through all of your different areas of governance. So also in policy area, collaboration, and all those other ones. So, domain one and what it covers. It's all about gathering data, and we do that in a variety of different ways. We get databases that there's already out there. We do surveys and collect our own data. We do focus groups or key informant interviews. It's all about using data, and it's getting it out to the community. It's getting it out to partners and staff use data. What it's on is the community's health, and we get it down to a neighborhood level or a zip code, or we do it for the county. And it informs our decision making. So it could be programmatic, it could be a policy, it could be what we're going to approach into the community. So that's what Domain 1 covers, gathering, using on the community's health, and making decision making. So how we do that work, I'm just going to give you some quick examples. Spokane Counts, this is our public health indicator report. There's 60 indicators in this report, and we update it every other year. And this year is an update year. We look at trends, emerging issues, decide what we're going to work on. We really look at health disparities, maybe in conjunction with the social and economic factors, and we do comparisons. We are required in the domain to look at environmental health issues, health behaviors, health care, health status, infectious disease, injury and violence, reproductive health, and then we have some summary measures like quality of life. Also, some of our divisions use data regularly. The maternal and child health requirement by the feds is that we do a report every 5 years in looking at the data. We did in 2008, and one of the primary data issues was maternal smoking that came out of that report. Because of that finding, the staff would do a deeper dive into the data and really look at maternal smoking. We just redid the report in 2013 and found that maternal smoking has improved over the 5 years. But of course, there are other issues that we can work on now. The divisions of health promotions and disease prevention and response, they look at data for a variety of issues. These are just some examples, maybe of more of the current ones. We get data requests from the community on a lot of different issues. I believe the gun violence was a request from the city to look at. And we just continue to use this information with our programs and with our partners. We get data requests from universities, businesses, schools, government, nonprofits. Usually we get about 100 to 150 data requests a year. We also have a lot of partnerships and collaborations that we do in the community, and part of this is by contract, or they pay us to do the work. We have a contract with United Way for the Accelerate Success initiative, and did their latest data report that they're basing their work on. My staff has been really good this last year, and she's brought in about $160,000 of contract work that has allowed us to actually hire a couple of new staff. So every 3 to 5 years, we are required to do a comprehensive community health assessment, and you may recognize Priority Spokane. We used Priority Spokane as our community health assessment in 2009 and turned in that assessment and improvement plan, and those are requirements of becoming accredited. So the first year that we did the priorities, 2009, educational attainment was the priority, and some of you, I'm sure, recognize that. Then we redid the whole assessment in 2013, and mental health came out as the #1 priority. So since we have that requirement to do a comprehensive community health assessment, there are a lot of other initiatives that are also out there that have to do that assessment. Providence Health Services is one of them, as the nonprofit community benefits from the federal government. St. Luke's has to do it, Shriners Hospital, Group Health, and now Better Health Together is an organization that is looking at the accountable communities of health and needing to do an assessment. Because of this increase in data, our desire for data, we have formed a community health assessment board. Their first meeting was held in October, and they have 3 goals really to increase our capacity around data, and then to hopefully have a unified regional assessment so we can meet everybody's needs at one time in 2017. We have really been inundating our community with doing a variety of these assessments, and so we really want to combine that. The partners on the board include, I believe Dr. Lutz is on there, but we have universities, we have different collaboratives that are represented, hospitals, healthcare, nonprofits, foundations, and public health. The universities have been very active in this group and are very excited about the potential to do research projects. So that's what the data is, how we do it, or how we meet the domain, but why is it important? It's always nice to have data, and you have these great reports, but what about it? And that's where it really is cross-cutting and hits the other domains in the public health standards. Domain 3 is around community awareness, sharing it with our community. We build partnerships by getting our stakeholders together to do these assessments. Then the data also helps us pick out our agency priorities and do our strategic planning, which is one of your governance areas, and also picking our priorities with our community and doing our community health improvement plan to improve the community's health. Our programs use it for their strategies that are evidence-based, and then also looking at how they can improve their services, so evaluating it with data and doing quality improvement. And then, of course, we want to obtain resources to do more and more work, and we use data to make those decisions, as well as our annual budget. We use logical decisions for windows, as you know, to do our budget, and a lot of data decisions are within those measures. And we do all of this because we want to improve the community's health. This is our latest vision statement: healthy lives, safe environments, and thriving communities. Short and sweet. Any questions?
Keith.
Thank you, Kevin. Lindia, I actually participated in the Providence assessment a while back, and I'm just curious because I've talked with a number of people who might want to use some of that data. It's not always very easily accessible. Is this board going to make that information maybe more accessible to just a community member? Because right now it's hard to find.
Right. So the Community Indicators Initiative with Patrick Jones for Eastern Washington University, that is kind of our one-stop shop right now that we're feeding data to. And then the linkages with the other partners who have the data is the best kind of clearinghouse that we have so far. It's hard to get it all in one place.
Yeah, I know.
Yeah.
Thank you.
Uh-huh.
Lindia, could you just repeat the web address for the Community Indicators Initiative so folks could access that?
Yeah, I think it's ewcommunityindicators.org.
I think it's communityindicators.ewu.edu.
Maybe, yeah. If you just Google community indicators, it'll pop right up.
Just Google. There we go.
And the same thing with Priority Spokane. But actually, if you do just priorityspokane.org, it will come up, although it'll come up as an EWU address.
Keith?
Well, now that you brought that up, you can actually call them up and talk to someone. Really? And they'll actually help you understand the data, which is really hard. I mean, it's just a graph, and there's not a lot of supporting information there. So really, they're really helpful when you call them up and talk to them. But again, it's not easily found, the number and everything.
They've actually just recently updated the website too, and it's much jazzier. So, any other questions?
Well, Keith brought up a good point about Providence does that huge community assessment, and I can't remember because I'm on the Prairie Spokane board, and we discuss these different data sets that are out there. Does any of that get put into Patrick's indicator work, or does he utilize any of that?
So when we actually, the health district helps Providence do their assessment every time. They do it every 3 years, so we just completed it this last year. And we use a lot of the data from Spokane Counts. They also use their emergency room data. Most of it's health data and demographics. So they really hone in on vulnerable populations, and so look at poverty and those type of things.
Any other questions for Lindia?
Thank you very much.
Okay.
Next is the strategic plan update from Linda Graham.
Well, hello again. So if you recall, last month did a brief presentation on our strategic plan and the goals and all that we came up with. And then you did an official resolution adopting that plan. So I was asked to come back this month and talk with you about how we're going to be moving from planning to actually implementation, because we don't want the plan to just sit on the shelf. If I can get it to go. There we go. So if you recall, we had 4 goals in the plan. Those are really the overall high-level statements of what we want to accomplish. The strategies were much more specific about ways to achieve the goals. And where we're really moving now is focusing on the actions. And these are specific actions or projects that really support the strategies. And this is where we're really focusing when it comes to implementation. So the action plans, we actually have 27 action items in our strategic plan. And the whole idea here was to break the goals down into very actionable steps, things that are tangible, that have a beginning and an end, things that we can actually know that we've accomplished and made progress on. And we had plans developed for each of these. We had staff throughout the agency create them. And these are really setting out the roadmap for how we're going to proceed with implementation. Each of the plans has major steps, those who are responsible for carrying out the plan, any extra resources that might be needed, and a timeline proposed for when we take on those actions. These have gone to our executive team, our executive leadership team. Those of you who don't know, that consists of Dr. McCullough, Torney, and then the other division directors. They did make some changes to the plans, and so those are being revised right now. And part of what they really looked at, too, was some of the timelines. And so along with the revisions, I'll be really working on how we lay these out for timeline to implement these over the next 3 years. We really can't take on 27 action plans or action items at one time, so we really need to be strategic in how we do that. We did prioritize all the actions into 3 tiers. And the first tier are really those things that are very essential actions. They're the highest level of commitment. And they're also items that are basically need to happen first before some of the other items happen. So I just wanted to give you a quick look at some of the Tier 1 action plans. And you'll notice that the bulk of them actually occur under Goal 1. And this goal is all about our work environment, and it's about our employees. And really felt that a lot of these needed to happen very quickly. It really is all about helping us as individual employees, as well as helping us grow as an agency and be stronger to help us accomplish the rest of the plan. So the bulk of the work is going to happen really quickly with Goal 1. And then, as you can see, under the other goals, there's really just one major action item that's in Tier 1. And these are really items that are necessary to kick off the rest of the work on those goals. So where we're at, action plans and timelines, we will have these completed and all laid out in the next couple of weeks. I will be then taking those timelines back to the executive leadership team for review, make sure they're comfortable with those. And then basically turning over implementation on each of those to those that were identified in the plans as kind of the leads, the responsible parties for overseeing them. We do plan to report back to you periodically on how we're doing with these, as well as coming up with ways to engage staff in the implementation and have means for staff to also monitor the progress we're making, some kind of a dashboard on our intranet site, those kinds of things. So any questions or comments about where we're at? All right, thank you.
Thank you, Linda. Board member check-in. Amber.
I don't think I have anything to report. Thank you.
I would like to say that NALBO, who you are all members, has had several webinars on legal issues around boards of health and how we operate or don't operate. And I sent information from the last one to Linda, didn't I? Yeah. Yes. And you can always go on to the NALBO site and look at the information. This last webinar I thought was really helpful because there were some fairly succinct or simple diagrams of how board members can participate in a legal and appropriate way. and what sort of other policy questions come up when we do that. So I thought it was really helpful. And just remember that because you're members of NALBO, this is free information to you. So there are 2 more webinars coming up, and one is in late April and then another one in May, I believe. But again, they're free. They're only an hour. But you can always go and look at the information on the website. And they really, I thought this last one was really helpful because it just gave some very simple explanations of how you can participate as a governing board member in public health issues, and what kinds of choices that raises when you do that. So I think it'd be helpful if everybody took a look at it. And we also have copies of the handouts, so if anybody wants those, Linda can get them to you.